Hey there, I'm Brian, one of the co-founders here at Bristle, and in this video, I'm going to show you just how easy it is to collect your patient's saliva sample for oral microbiome testing. Before we begin, please make sure your patient avoids eating, drinking, or smoking for at least 30 minutes prior to collecting their sample. We also recommend taking a patient's saliva sample at the beginning of the appointment prior to introducing any interventions that may impact their results, like periodontal probing and mouth rinses. If the patient has recently eaten or used oral care products right before their appointment, the Bristle test can still be registered and sent home with them to complete after the recommended waiting period. You can find the full guide of how long we recommend waiting after different interventions in our saliva collection instructions below this video. Before we get started, let's first make sure we have everything you need to take the saliva sample. In your kit, you'll find one saliva collection tube with a blue lid, a funnel that we'll use to collect the patient's saliva, a clear biohazard bag, and a prepaid shipping envelope that you'll use to return the patient sample. When you're ready to get started, take the collection tube and make a note of the barcode number, which we'll use to register the sample to this patient. We cover that in the next video. Next, we'll remove the cap from the collection kit, but be sure not to spill any of the stabilizing fluid that's inside the tube. You can see it there, as this preserves the sample at room temperature while it's in transit back to our lab. Next, we'll take our funnel, like so, and clip it into the tube. You can feel it snap tightly in place. This is what we'll use to collect the saliva sample. Have the patient spit directly into the funnel until you fill the collection tube about 2/3 full of solution. Once you finish collecting the saliva sample, just screw the lid back onto the tube like so, and shake it 5 to 10 times to mix the stabilizing reagent with the saliva. After you've shaken your saliva sample, we'll then put it into the clear biohazard bag and seal that. And then we'll place that clear biohazard bag into the prepaid mailing envelope that's included with the test kit and seal the prepaid mailing envelope. Note, Bristle samples do not require any refrigeration or ice packs and are stable at room temperature. You're now ready to return the sample to any USPS mailing facility or blue box, and both you and the patient will receive an email as soon as the results are available in 2 to 3 weeks.